Let me begin by expressing my sincere appreciation to each of you for accepting the invitation to participate in today's press conference. I take this opportunity to extend heartfelt thanks to all our nurses, doctors, allied healthcare providers across Antigua and Barbuda. I also express my appreciation to the workers of the Celeste Bird Medical Center, our community clinics, Clearview Psychiatric Hospital, Barbuda Wellness Center, Hannah Thomas Hospital, and the Fines Institute. And I should also include the CARE Project. Your unwavering commitment and dedication to our healthcare system are truly commendable, and we remain deeply grateful for your service. I also acknowledge the challenges we are currently facing, particularly the shortage of nurses, which has placed a significant burden on our healthcare services. I wish to assure you that the government of Antigua and Barbuda is working diligently to address this matter, and I will invite the medical director of Celeste Bird to comment further on this, the progress we're making in this regard. Our aim is to ease the strain and create a more wholesome, supportive working environment for all healthcare workers here in Antigua and Barbuda. Additionally, I want to recognize and thank the staff of the Ministry of Health, along with our statutory bodies and departments for their continued hard work and notable accomplishments, some of which will be highlighted during this press conference. In a special way, I wish to welcome Dr. Siobhan Bell Jarvis and extend my congratulations to her on being appointed the first Antiguan to serve as a medical director of the Celeste Bird Medical Center since its opening. This is a proud and historic moment for our country. We also take this moment to remember with gratitude the late Dr. Albert Duncan, who previously served as medical director. Though his tenure was cut short, his service and contributions remain a lasting part of the hospital's legacy and the lives of the people of Antigua and Barbuda. Today's press conference is focused on a limited number of important issues. However, let me assure you that moving forward, we will create the frequency of these engagements. Our intention is to ensure that the public is regularly updated on the current work and progress of the Ministry of Health. From time to time, senior officials will also participate to provide a more comprehensive update of what's happening in public health in the state of Antigua and Barbuda. I want finally to thank you again for being here. Let us now proceed with today's agenda. But before I do that, I will give everybody an opportunity to introduce themselves, not to assume that everyone who are in the viewing audience knows the senior public officials. I start with my permanent secretary on my right, and by the way, the Ministry of Health has two permanent secretaries, one for primary health and the other for statutory bodies and other departments of the Ministry of Health.
Good morning. Good morning. P.S. Gregg, Permanent Secretary within the Ministry of Health with responsibility for primary health care.
Good morning, Dr. Siobhan Bell Jarvis, Consultant Pediatrician.
Good morning. I'm Clarissa Christopher, and I'm the Acting Principal Nursing Officer in the Ministry of Health.
The first area of I wish to make some comments is the issue that has occupied the attention of the public, and that is how soon will the Tranquility Park Cemetery be opened? I could not have anticipated the great interest in this development, but that is driven by the human realities that we have to bury our dead from time to time. The date has been set on the consultation of the permanent secretary and senior officials that the Tranquility Park Cemetery will open on the 1st of September. We are able to make that announcement, having done several dry runs to be sure that the whole management of interment is professional and it is characterized by our tradition that we should honor the dead, be reverent. There are certain things that will change, and that is the interment will have certain standards and restrictions, and I will just go through a few. And some of these will have to be through legislation, through the amendment of the Act. And I've been advised by our technician that one of the first things that we should say to the public that at these interment, visitors must maintain a respectful and peaceful demeanor at all times. This might appear to be a simple matter, but those of you who have attended many funerals, I hope you become as disgusted as I have been many times to see at funerals people are cavorting, playing music, drinking, smoking, and behaving in an irreverent manner. That will not be allowed in this new cemetery. As a matter of fact, we will have security forces in place to kindly escort people from the premises if they violate the rules. Loud, disruptive, or offensive behavior will not be tolerated. Alcohol, illegal substances, and smoking are strictly prohibited within cemetery grounds, and the cemetery reserves the right to remove any person engaging in inappropriate conduct. In terms of visiting hours, the cemetery is open to the public from 6 a.m. to 6 p.m. daily. We have an office there, and people can visit within those hours. Entry outside of these hours requires prior authorization. Vehicles parking and authorized vendors. This is a problem. We are likely to have vendors, and we are now identifying an area designated for vendors. It cannot be random. It cannot be well escorted at this site. It will be designated areas, and unauthorized vendors will be swiftly moved if they cannot just show up and decide to take up areas within the cemetery. And in addition to that, the vending outside of the fence around the perimeter is also prohibited. And that will have to be enforced, perhaps sometime by DCA or by the people who enforce littering and so forth under the laws of Solid Waste Authority. This year we deal with a matter that might be very sensitive, and that is floral arrangements and decorations. There'll be no plastic allowed. We ban plastic in Antigua and Barbuda. And if you want to see how difficult a problem that is, visit the current public cemetery, and you see it's littered with plastic, many of the floral arrangements that have been there for years. What I suggest is that we go back to the tradition of getting live flowers at our funerals. That does not mean, let me be very clear, that you cannot have your floral arrangements at home or decorate your store or even your offices. But we cannot allow the burial ground to be a dumping site for plastics. Cannot allow that. So if during the time that we opened the cemetery, that some people did not hear about these standards, we will understand and give them time to make adjustments. But strictly over the next several months, we hope that the public can adjust to that standard. Monuments and purchase of plots will not be initiated at this time. We have several people who would wish to buy plots, but we have a 20-acre, approximately 20 acres, about 19.2 acres of land that has been designated. It's not the area that is presently fenced. It's more than that. Many people pass and they see a section fence, and they're assuming that's the cemetery. It's not. The cemetery goes all the way down to the Heroes Park, and it's 19.2 acres. And for you to appreciate the potential for this to be long-lasting, I can tell you that the public cemetery is only 4 acres. So the current cemetery is almost 5 times the public cemetery, and the current public cemetery was opened in 1889, over 130 years ago, and that has served Antigua and Barbuda. So there are some of the comments in the public space who say, well, this won't last long because they're only looking at the area that is fenced. And I said before, all monuments, headstones, and so on will have to be implemented at a later date. We have already been the victim of vandalism, unfortunately, but my PS has instituted some arrangements. I think that will bring an end to that. It's unfortunate. I do not know how people can work up their minds to stealing from a cemetery, but those are the realities of life today. Safety regulations will be implemented and will be enforced, and these will be promulgated so that all families would know how children are to behave in the cemetery and so on. There will be a notification as you enter the cemetery to assist the public in understanding what level of behavior we anticipate that they will display. So the 1st of September is the date when interment will begin. The issue of purchasing of plots has not been established as a policy yet. The time will come when the public will have an opportunity to purchase plots. There is a major difference in terms of the interment that we have grown accustomed to in the past. Normally, bodies are buried 6 feet. These graves will be dug 9 feet to allow for 2 bodies in each grave. The reason why 9 feet was chosen, because over the years we have observed that when a grave is being reused, that they disturb the first grave, the first body, and the removal of bones. And we believe that after someone is buried, there should not be any disturbance of their remains. And so I know that there is some speculation that the reason why the graves are being dug at 9 feet because the place is waterlogged, and I heard it myself. They're saying that we are afraid that the body will float. Now, the point is that the boreholes were done by the experts, and at no time when we did the boreholes we observed any water. And so I hope that settles that. That has nothing to do with water. So that's the explanation for that narrative that is out there. So that is as far as the Tranquility Park is concerned. There is an issue that was raised recently in the public, and I wish to address that particular concern. So just allow me to make this statement. I wish to address a concern that has been raised regarding the temporary closure of the All Saints Health Clinic. While I welcome public dialogue on matters of healthcare, it is important that such discussions are based on facts and placed within the wider context of the significant investments this government has made in our healthcare system. When the All Saints Healthcare Center was temporarily closed in April of 2023, immediately measures were put in place to safeguard access to care. And let me pause here, that there was extensive discussion with the leadership of the nurses at all steps of the way. And that is documented. Residents of All Saints and neighboring communities were directed to the newly built Glanville Clinic, which is fully equipped to serve their needs. Recognizing the possible challenges of transportation, my ministry introduced a free coaster bus service to transport patients to and from Glanville, ensuring no one was left without access to medical attention. The reality is that the state of disrepair in our public clinics is not a recent development. When I assumed the portfolio of Ministry of Health in 2014, a comprehensive review by the then Principal Nursing Officer was requested, and her findings revealed that every single public clinic in Antigua and Barbuda had been neglected for years. And I have the report that I could easily share with the reporters here. Since then, this government has taken decisive steps to reverse that trend. We have built 2 new polyclinics in Villa and Glanville, carried out major refurbishments at the Parham, Clear Hall, and Liberty clinics, constructed a new clinic in Bowlands, and are preparing to open a new Corps Course clinic. Plans are also advanced to temporarily relocate the Browns Avenue Clinic to the Halberton Hospital site to facilitate major renovations. The redevelopment of the All Saints Health Center must be viewed in this context. The delay in reopening is not due to inaction, but to our deliberate decision to significantly expand and modernize the facility. And I'll give some details how that will be done. The new center will be larger, better equipped, and capable of delivering a wider range of services. Consultations are ongoing with doctors, nurses, and technical experts to ensure that the new design is efficient, functional, and patient-centered. I assure the people of All Saints West and the surrounding communities that this government remains committed to their well-being. Once completed, the new All Saints Health Center will not only meet but exceed expectations, delivering a modern, safe, and accessible facility worthy of the community it serves. Now, it's important for me to share with the public some more specific details. I have with me there are 26 clinics. Am I correct?
Yes.
23 clinics. 23 physical facilities serving 26 communities.
Yes.
Is that correct?
That is
Exactly. Let me repeat. 23 physical facilities serving 26 communities. I have them all here. And this is what we have been able to accomplish since 2004. Parham, that was renovated in 2017. Judges Hill, renovated in 2018. Five Islands was closed because Five Islands was housed in a 40-foot container, which was inadequate. And Five Islands was taken up by Green Bay Grace Farm Clinic. And then we have the Villa Polyclinic in 2020, Granville Polyclinic in 2020, Bowlands, a new clinic in 2023. Clear Hall was renovated in 2024 and is designated to be a polyclinic. Liberta renovated extensively. As a matter of fact, Liberta was rebuilt in 2025. Old Road was placed in a new location and also renovated. Cops Cross is a totally new building and should be open within the next 2 weeks. Grace Farm was also renovated but has a serious structural problem with its foundation and will be addressed. It is not an easy problem because the building was built on the side of a hill where the water comes consistently. And just last night, the architect told me no effort was made to seal the foundation so the water seeps under the foundation, ends up on the floor in the building. That is due for major engineering. Cedar Grove Clinic, which started in 2008, was completed in 2017 and is in excellent condition. Barbuda, after hurricane and was devastated, was completely rebuilt with the design of PAHO. We got PAHO to fly to Barbuda to look at the building. They did the redesign, and the Barbuda Clinic was totally rebuilt. There are 3 clinics that are in poor condition and are scheduled to be fixed: Potters, Pickett's, and Jennings. Those have not started. The Belners Clinic was repaired and even has solar energy, but it's too small, and a new site has been selected, and the building for that clinic has been ordered. Newfield, Freetown, and Bethesda are in the same category as Potters, Pickett's, and Jennings, and those will be repaired. The Browns Avenue Clinic, which is really the issue that has caused the delay of the All Saints Clinic. All Saints Clinic was to be started with its renovation, but then we had to close the Browns Avenue Clinic. By closing the Browns Avenue Clinic, we had to do some repairs at the Halberton Hospital to relocate them. And as a result of having to relocate Browns Avenue Clinic, we had to hold a bit on All Saints Clinic repairs. Now the Browns Avenue Clinic relocation is completed. The nurses have started operation in the clinic. Now the contractor will now be redirected to the All Saints Clinic, and we are going to have at the same time both Browns Avenue Clinic and All Saints Clinic having major repairs. The All Saints Clinic, I'd like to raise an issue here. We sometimes get a bit distracted on the issue how important it is to have good infrastructure. I think I have with me the plan for the polyclinics, and I would like to share. Because All Saints Clinic, I'm recommending also that it be a polyclinic. It sits in probably one of the most populated region area in Antigua and Barbuda. And the public ought to know this. The services we normally provide at these clinics are antenatal clinic, postnatal clinic, neonatal assessment and follow-up, child health clinic from 0 to 5 years old, wound care clinic, pap smears, hypertensive and diabetic clinic, psychiatric clinic, medical clinic, physician's clinic twice per week at Glanville, but daily at Villa, nutritionist clinic, and dental clinic. Now, when we expand the services in these polyclinics, these are the services we intend to add. Daily medical clinic with physician available for service Monday to Friday at all polyclinics. We have to get to the point where physicians are at these polyclinics every day at hours that are accessible to the public. We will also add eye care clinic, ophthalmologist twice per month for full consultation, specialist clinic, nephrology, internal medicine, gynecology, and urology. That service will be available on a monthly basis, and daily pediatrics. We'll also have in those expanded clinics daily laboratory services, CBC, chemistry panels, kidney function markets, you know what?
Kidney function
Tests, okay. Lipid profile, glucose, and urinalysis. Now, we also have daily radiology services, ultrasound, X-ray, to include chest and limb, daily EKG services, and each one will have a pharmacy. Now, if we do not carry out our plan for All Saints Clinic to expand it, it will not have these services. So we cannot be distracted, frankly, by opportunistic comments about late repairs and so forth. The real problem is that we cannot claim to service the people of Antigua and Barbuda when we have a situation in the country that all these services are dispensed by the Celeste Bird Medical Center. It makes absolutely no sense. We've got to have our polyclinics in place. And part of the problem we have in Antigua and Barbuda, and I know this, and I'm sure that the medical director knows it more than anybody else, everybody goes to the Celeste Bird Medical Center for the lease of services. So this is the reason why All Saints Clinic was delayed. Now, the good news is that I think somebody might have known our plan. The point is that the contractors are already on site at the All Saints Clinic and will soon be at the Browns Avenue Clinic to begin the process of rebuilding those facilities. Now, you would have observed that the list I gave you, all these were done since 2014, and it's only about 8 of the 23 clinics are yet to be addressed. I would want to think that that is a good strike record. Now, here is where I must balance this thing. What has been the problem why clinics are not repaired on a timely basis? It has to do with financial resources and how you address the financial resources. You address the financial resources by making human health a priority, and the resources must be found. The medical benefits was designed to be an integral part of providing these resources for the building out of infrastructure, out of what the law calls reserve funds. In other words, medical benefits must get enough contributions to be able to pay for the medicines to treat the people of Antigua and Barbuda and the vitamins. However, the medical benefits from time to time have reserve funds, which is a good thing. As a matter of fact, the healthier the people, the less medical benefits would have to pay for pharmaceuticals and other things. In 2004, after the new government assumed the management of this economy, the record shows that almost immediately after 2004, to be specific, the 25th of November 2005, this government invested $6 million in CLICO at a time when CLICO, insurance company and an investment company, had financial problems. But it didn't stay there. In August of 2007, these are medical benefits funds. They invested $3 million. Did I say 1,000 or 3 million? 6 million and 3 million in BICO. Then in August of 2008, they hawks out another $4 million out of medical benefits and invested in BICO. In 2008, they couldn't resist, then another $2 million. $2 million. In total, $15 million of the surplus fund of medical benefits was invested in CLICO and BICO. So what happens? They claim that they were going after high interest rate. Now, if banks are giving interest rate of 5 and 6%, and someone else comes to you and say, an insurance company comes and said, I can give you 10% for your money, I think you should scratch your head and say, how is that possible? The market is saying 5%, and someone is coming to you and say 10%. And so they go for the 10%. The result of that is that as I speak here today, those companies have about $16 million for medical benefits. $16 million. That could have been used to fix all the clinics in Antigua and Barbuda and build new ones. This is not a fabrication. I have the report right here for medical benefits. It's right here. So I just want to make the case that this government has done very well, because when I took up the office as minister, I asked the Prime Minister, please, just allow the surplus funds to be used for health purposes. And so the government has lived up to that commitment. As a result, we are able to use the surplus funds to subsidize the operation of the Celeste Bird Medical Center. Isn't that so? That is the way it works. So that is what medical benefits funds are for. Not to be invested in high-risk businesses. And as a matter of fact, as you know, I don't know if you all keep up with what's happened to CLICO and BICO. It went through the whole OECS. And not only that, they are aggressive. You got to give them some credit. Taxi men have lost hundreds and thousands of money through these companies because they come and they offer high interest rate. They were seeking to raise money because they were going bankrupt. And I can tell you, they are bankrupt right now. They are bankrupt right now. So that's the case. This is what has happened. But I am confident that the government will stay the course, and we will continue to meet the demands of the people, and that is to build good health infrastructure. Now, I've said enough on these issues, and so I will allow the PS to take the floor. We have issues of mental health, the National Health Insurance, and legislation going to Parliament. And so I'll ask the PS to address some of these issues.
Good morning again. With regards to the mental health legislation, we'll be having public consultation with that next month with the assistance of the Pan American Health Organization. PAHO will be in country, and we will meet with several stakeholders with regards to that. And that's about it. Dr. Bell Jarvis, I'll let you take over with regards to the hospital.
So much. Yes. Greetings once more to our viewing and listening audience and members of the media houses here today. It is indeed my privilege to sit before you because I find that accountability and transparency are at the heart of the management of any healthcare system. And so I seek today to go through milestones that we have achieved at the Celeste Bird Medical Center, but also to acknowledge that we do have challenges and that there are significant areas that need to be optimized. That being said, I must thank the staff at the Celeste Bird Medical Center who are at the heart and soul of what we do, because without the staff, we really would not be able to reach out to our communities. And so I want to start by addressing milestones and that we've had, especially in advancing specialized care. As it relates to renal health, I'm pleased to report that we have completed the 13th renal transplant in the history of our hospital, and this was done on the 15th of August, which was Friday. Indeed, this is monumental. We would have started renal transplants in 2017, so basically a mere 8 years ago. The patients have been doing well, and to date of the 13, we had one patient who would have passed 4 years post-transplant, but this was an unrelated cause, so not related to the transplant at all. And we had one patient who had to revert to dialysis. But I must commend the nephrology team, the operating theater staff, the medicine team for a job well done, because again, this is life-changing. It indeed improves the quality of life, and so this is significant. In that vein, I therefore speak to the upcoming renal center, which is quite visionary. So at the Celeste Bird Medical Center, we would have made advancements in dialysis, where we have 27 stations that are able to offer dialysis. We would have expanded by 10 additional stations. But with the renal unit, which will be at the Halberton Hospital and currently is in construction, we'll actually be able to go up to 39 stations. 37 stations for hemodialysis, 2 of which would offer a private facility. And then we have 2 stations which would facilitate isolation, especially as it relates to infection control. And we'd also be able to facilitate peritoneal dialysis, or the peritoneum is that lining within the tummy. So we're going to be able to utilize the tummy for dialysis. And that is the first phase of the renal center. So I must say that we're doing well from a renal health perspective. However, we must focus on preventative care, because even though we do want to offer dialysis and we want to be able to offer renal transplant, we want to help Antiguans and Barbudans and anyone within her shores to avoid going on to having chronic kidney disease. Let's speak a bit more about the nervous system, the central nervous system, or brain health. Stroke certification. So in June of this year, we would have been formally assessed by the World Stroke Organization to be a certified stroke center, which means that we would follow evidence-based protocol in the management of stroke. We are still awaiting our results to this date. We should know by the end of August. But should we be successful, this will help Antigua and Barbuda to be the leading facility in the small island developing states as it relates to stroke care. This is indeed monumental. Mental health response. We recognize that we do have a mental health crisis, and prior to this year, what you would have found is that any patient presenting to the hospital with mental health concerns would have had to go through a myriad of testing and would have taken quite a long time to be referred to Clearview. However, we have now changed the landscape, in collaboration with the 3 psychiatrists at the Clearview Center, primarily in collaboration with Dr. Benjamin and Dr. De Silva, we have now facilitated mental health being accessed directly at the Sir Lester Bird Medical Center. Therefore, anyone who presents in mental health crisis can be seen by the psychiatrists in the emergency room, and we have even gone further in the collaboration where we now have what is called a consultation liaison service. This simply means that the psychiatrists are available to come to the ward to see both adult and pediatric patients and offer guidance in terms of the management. And they're even seeing children on a Friday. We can refer to them on a Friday where they're able to integrate our children into the mental health management plan, which is new because before that, mental health concerns for our children, we had to go through the private route. And so I've spoken to renal health, I've spoken to stroke care, I've spoken to our mental health crisis response. I want to speak to the incinerator. I'm sure you would have seen our release within the last 24 hours in a very forward-thinking step, which I must again thank the government and also Sir Maureen Joseph in being a part of the vision of optimizing our waste management. Indeed, we recognize that that local step will have global implications as it relates to the impact on climate change. It's very important for us to appropriately manage medical and non-medical waste, and we're speaking to things like expired medication, chemotherapy, things that are utilized in terms of patient care. So this is very forward-thinking, and it also is protective as it relates to not only patients, but also staff and by extension, our communities. Let's speak to capital assets. I know that we have had an interest as it relates to the investment of significant equipment. As you can imagine, from 2009 to present, a lot of our equipment have completed their life course. And so it was very important for us to strive to analyze the equipment that we do have and strive to replace them. We thank the Cabinet for approving in the initial instance $1.8 million. Thus far, we have spent $1.3 million, and the breakdown in terms of our expenditure is as follows. We have upgraded the fire alarm and fire pump systems. We've replaced the sewage pump system. We've purchased an autoclave machine for the operating theater. We have serviced our chiller system. We have procured ophthalmology equipment in the face of 2 tonometers, a surgical chair, an automated biome, which helps to do surgeries at the back of the eye. We've also garnered orthopedic equipment. We've also purchased an industrial barrier washer and ironer. We've also upgraded what is called our PACS system, the picture archiving and communication system, which is used to look at X-rays, CTs, MRIs, ultrasounds, and which enables not only physicians within our immediate location, but even physicians with secure access in other jurisdictions to look at images for our patients. We've also gotten an electrosurgical generator and an anesthetic unit with 3 gas capability. The balance remaining as of the 15th of August 2025 is $572,184, and this has been earmarked to optimize our ear, nose, and throat service, as well as to continually optimize our operating theater services. I must speak as well to eye health, and I hope I'm not going too fast. And by the way, this is what we've accomplished over the first 8 months of the year, which is phenomenal, if I must say, and again, we thank the staff and the various teams. The Trinidad Eye Hospital, we have been working in collaboration with them since 2019. And to date, we have completed 1,108 surgeries where the vision for our nationals and anyone within her shores have been restored. 1,108 surgeries. This is testament to the commitment as it relates to optimizing the health and well-being of our nationals. This is a part of our capacity building strategy because not only are we doing surgeries, but we're also optimizing the capability of our staff through continuing medical education and hands-on experience with visiting physicians. I want to speak at this point in time to the sickle cell unit. Now, as you can imagine, and as you probably would have seen, we would have done a site visit to the sickle cell workshop. This was done on the 24th of July, where we also would have taken the time to pass through the IDC, where we have identified an area which would serve as the sickle cell unit. Now, the commitment to sickle cell disease management is not new. As a matter of fact, the Sir Lester Bird Medical Center, in collaboration with American University of Antigua, as well as the Sickle Cell Association, have been in collaboration since 2020. So from September 2020, we've actually screened just over 4,700 newborns. Now, the commitment to sickle cell disease goes beyond newborn screening. It must include appropriate care for crises, which includes pain and other such presentations. Therefore, it was deemed to be very important in order to facilitate optimized and efficient care for patients with sickle cell disease to have a sickle cell unit. During my training, I was very fortunate to be a part of a sickle cell unit in another jurisdiction. And we did see a difference in terms of the outcomes and even quality of life for sickle cell patients who presented to the sickle cell unit, as it optimizes education, it optimizes immediate care, and it optimizes holistic management. Therefore, I would have done a site visit yesterday, and I'm pleased to report that significant repairs have been done. The roof is no longer leaking. The walls have been painted. What is left to be done is the installation of a ramp to facilitate ease of access for our patients, and also the implementation of gauze. We actually prefer not to utilize the air-conditioned unit because it can trigger crisis. And so because of that, we prefer the natural air and ventilation, and therefore the institutional installation of gauze is very important to reduce the impact of our mosquitoes. If I may then speak to, and by the way, I have here as well, if you would like to peruse after, myself, Minister, both Sir Malwin Joseph as well as Senator Michael Joseph and Dr. Hadid would have gone through a very detailed document as it relates to the management of the proposed sickle cell unit, looking not only at infrastructure and staffing, but also looking at the long-term plans and sustainability. So although we do believe that from an infrastructural perspective, we will be complete within the next 2 weeks or so, it is very important for us to have appropriate staffing. Now, we're thinking to have at least 2 physicians and 2 nursing staff. We also need clerical staff. But it's not just about having staff, because we want staff who are compassionate, staff who have empathy, staff who are passionate more so about sickle cell disease, of which we've already identified 2 physicians. These physicians will have to undergo specialized training, at least a month overseas, a short stint in a sickle cell unit, so that they can appreciate the management, as well as they will have one-on-one sessions between Dr. Hadid and myself in terms of the overall management of sickle cell disease, having a framework in place, and then subsequent to that, we will be ready. We have been keeping in touch with the members of the Sickle Cell Association. As a matter of fact, persons affected by sickle cell disease and their families would have been in my office even up to 6 weeks ago. And what we strive to do is to see what the challenges are at the Sir Lester Bird Medical Center, so that we can optimize that in the interim until we move over to the sickle cell unit. I now move on to the issue of staffing, where I'll cover nursing as well as general staffing concerns. And then I will seek to conclude by speaking about our health information system and then the emergency room. So let's speak a bit about staffing. We recognize that a shortage in our nursing staff is not limited to Antigua and Barbuda. It is actually of public health and international concern, if I should say. It therefore means that we have to be very strategic in terms of how we approach this challenge. and therefore we have opted to look at approaching this from a perspective of retention. So we're looking at how do we retain the nurses that we already have, how do we optimize conditions, how do we improve salaries, but we've also looked at how do we safely and appropriately and through a structured manner recruit nurses to fill the immediate gap. You can imagine that at the Five Islands campus for the University of the West Indies that it does take 4 years to get your bachelor's in nursing. It therefore means that it will take some time to continually put out nurses. So therefore we have to look at how can we stop this immediate gap, and therefore structured recruitment is one of the ways that we can do so. We have had a multi-stakeholder engagement with our nursing administrators, from the Nursing Council, from the Sir Lester Webb Medical Center, from the Ministry of Health. We have to include our Superintendent of Public Health Nurses as we discuss the best way forward. We therefore, through the support of the Cabinet, have looked at recruiting nurses from various jurisdictions to include Ghana, India, the Philippines. And this, as I said, is not a long-term plan. Rather, this is a means of bridging the immediate gap. The areas that we've opted to focus on include the following: the emergency room, the intensive care unit, dialysis, the operating theatre. Now, in the initial instance, what we hope to do as well is to also recruit nurses as it relates to the community, because we recognize, especially as we focus on mental health and we transition to the Mental Health Behavioral Institute, that it will be very important to have appropriately trained nurses specialized in mental health. So we have included mental health nurses, cardiology nurses, neonatal intensive care unit nurses, as well as members of allied health. So with that being said, in terms of retention, we were just speaking just prior to the press conference that one of the things that we probably need to look at is having our nurses undergo a period of internship or a minimum amount of time that is spent within the hospital before they're allowed to go to community. That way we'll be able to bridge the gap whilst they get experience. So just like physicians, we have to do an internship period, and you may have to work X amount of time before you go to community. The same thing we're thinking should apply to the nursing fraternity as well. That being said, in terms of the emergency room, we recognize that that is an area that requires significant improvement. And therefore, one of the areas of focus over the next 3 to 6 months will be the emergency room. We recognize the importance of having senior oversight. We also recognize the importance of having efficiency as it relates to seeing patients in a timely manner. We recognize the importance of diagnostic accuracy, and therefore for us, we're optimizing our senior oversight. To date, we have had 2 physicians returning home who have completed their specialization program in the emergency room or emergency medicine, Dr. Sujay Gore and Dr. Ozumba. They have returned and are now on staff as senior members in the emergency room. By the first week of September, we have a pediatric emergency room consultant, Dr. Solowski, who will be with us. He's joining us from Canada. And we also have another physician, Dr. Whittington, who should be here as an adult emergency room consultant. We've also found the need to optimize other specialties in the form of neurology by adding a neurologist. And we are concerned in terms of the turnaround time as it relates to pathology-related samples. So we have also garnered 2 additional pathologists, which we hope will join us before the end of the year. I must also congratulate Dr. Karim Matthew, who has also recently completed anesthesia, again, one of our local doctors, and so he too has added to the oversight and senior governance from the operating theatre perspective. The emergency room, we did training as well. So we recognize that one of the challenges in the emergency room is in terms of triage, recognizing who is the most ill, who may need to go in before another person based on the what we call emergency severity index. And so what we would have done is that we would have invested in training all doctors, nurses, customer experience agents in the Emergency Severity Index training program. They did not have to pay for the training course. The hospital paid on their behalf because we found it crucial for persons to be appropriately trained so that we can appropriately triage and manage our patients. That being said, I look forward to reporting back to you within 3 to 6 months as it relates to the emergency room, where we take a closer look at wait times as well as outcomes. And so lastly, I speak to our health information system. We have gone a long way. Basically, we have completed our HIS, for short, in the emergency room, in financial registration, in medical records, in the pharmacy. And so now we are transitioning to having our health information system in the laboratory, in radiology, and also in what we call bed and patient management. There are 4 phases to the project. We are basically transitioning into phase 3. And so I would be happy when we are fully electronic, so that it is easier in terms of efficiency. We can better track what each physician is doing in terms of output, because that is another area that we're looking at, accountability as it relates to how much are you really giving to the hospital on a daily and on a monthly basis. So the health information system will be something that is, transformational for us, and ultimately it will be in the clinics as well, so that we speak one language. So when you come to follow up at the hospital, we can look at your clinic record. We don't have to ask you, so in 2007, what happened again? We can just pull it up and we can see, okay, you had a hysterectomy, you have hypertension, these are your medications, and so you can already see it will make the system more efficient. I end by saying that, good does happen at the hospital, contrary to what is put forward. What we do have, unfortunately, is a culture that focuses on negativity, and media environs that focuses on sensationalism. And I say that without fear or favor. I'm not saying that the hospital is perfect, and as I said previously, I am fully committed to being accountable as to what we do. One of the things that we've emphasized, not to prolong, Minister, please indulge me, is that we have opted to highlight job descriptions. Job descriptions are important, because how can I keep you accountable for what you do not know is your role? And so we have embarked through the assistance of HR of ensuring that job descriptions exist for every role, something that was not there previously, so that when we do your performance appraisals, we can objectively say you're not hitting the mark, or you're doing well, or these are the areas that you need to improve. In doing that, therefore, when we are ready to have our investigative meetings and our disciplinary hearings, we are able to act on more objective data and make changes. At the end of the day, we can train with customer service. We can train in terms of skill sets, but you really cannot train an individual to be better or to be passionate, right? But what we have to ensure as an institution is that we offer an optimal working environment. We make available the opportunity for upward mobility, and that we ensure that persons are appropriately trained. We have also continued to do what is called a root cause analysis. So for negative outcomes or near misses, we pull the charts, we sit down, we review, and we try to see how can we avoid this from happening again. So I end almost as I began. The hospital is not perfect, but good happens there, and good must be celebrated. I looked at the release for the incinerator, and there were 58 likes, 4 comments. I looked at other negative press shared in the last 2 to 3 weeks, 348 likes, 33 or more shares, and almost 100 comments. If we focus on negativity, that is what we will see. I must say, as an institution, we also can do better in putting positivity out there, and patients can also assist by giving testimonials when good happens. Again, I'm willing to be accountable with the staff for anything that does not go the way as it is planned. But ultimately, how I know that the system works, we'll have less complaints, we should have less negative complications, or negative publications, sorry. I should get called less to say, hey, this person is waiting outside for 3 hours, can you help? If the system is working, it should work irrespective of who you are and irrespective of anybody being called. So I'll know that the system is working in that regard. And then I will know because I'll see a difference in the morale of the staff as well. You can imagine, as a pediatrician, if you look at children and you only speak negative to them, I don't think that you would expect them to have a positive morale. Likewise, I don't think that the public understands what sometimes negativity does to the morale of our staff. That being said, we are committed to doing better. We are committed to optimizing our staff, and we are committed to ensuring that the Sir Lester Bird Medical Center is a place where patients feel comfortable, confident, and that stands as a beam in the organization of the Eastern Caribbean states and beyond. Thank you.
Nurse, would you like to make some comments? And I think you're doing an excellent work in your training of nurses and how we plan to make the nurses, the foreign nurses, not a permanent feature, but only a temporary, what you would say, measure. But our plan is to do the long-term training, and we have our nurses in university. We have 15 of them doing the public health. I think that the public would be happy to hear about that.
Okay, good morning. Well, it's afternoon. Good afternoon to all again. Just to support what the minister would have said, and in somewhat support Dr. Bell Jarvis. I am responsible for nursing in Antigua and Barbuda, and so wherever the nurses are, I'm very much aware of what is happening and try to be aware. We would have spoken about the clinics, and it's very important that we recognize the importance of primary health care. Primary health care is a critical part of nursing, and it's a preventative area. So when we are able to get the clinics up and going and really working as they should, it will reduce some of the work of Dr. Bell Jarvis, because they'll be only able to really focus on acute care. And that is our whole intention. So I am in support of what the minister would have said earlier, where he spoke about the different clinics and what is happening. I really want to commend the staff, though, the nursing staff, wherever they are in the clinics, in the institutions, and at Sir Lester Bird Medical Center. They have been doing an excellent job under the dying pressures. But I just want to say right now, the Browns Avenue clinic staff, I know they are quite happy, because they would have gotten a refurbished area, and when you find time, you can go and look at the area. It's very nice. I spoke to them yesterday. I spoke to customers in terms of clients, and they were quite happy to be at a cleaner environment, at an environment where they feel a little bit more safer. And any time you have persons are safe, feel safe in their work environment, their morale will be lifted, and productivity will be higher. And we are expecting that the nurses there will continue to give the high quality care that we expect. We do have a problem with shortage of staff, and as Dr. Bell Jarvis would have said, it's not just here in Antigua. I would have just returned from a regional nursing body meeting in Barbados, and that was one of the high points of the shortage of nurses regionally and internationally, and what are we going to do in terms of retention of our nurses. Yes, some persons have opted to go and have recruitment, but that is not a long-term plan, because we are hoping to have domestic nurses. We have to look at our domestic space, that when we have our own nurses, we will be able to know that the culture basically remains. So one of the things we are doing from the ministry standpoint, we are training what you call a 6-month assistive nursing personnel. They are nursing personnel that would have gotten a very rigorous training for 6 months, that they will support the care that is being given by the RNs. they'll be supervised, so they'll be working under. And we are hoping from that, and also soon you'll hear about it, we are hoping to go into what you call a nursing assistant program, which is going to be an 18-month to 2 years program, and that is going to, by that training, they will be more supportive to the nurses, where they'll be able to give a little more. They'll be basically utilized as almost a second-year student nurse. And then from that, we are using that platform again to continue to bridge them into going into the full registered nurse. So you see that we are definitely planning that in order to strategize to have our nurses, because we do need nurses. Our ratios are low, we can have burnt out, and we don't want that. So we are working on education in terms of pushing, and yes, we will be doing recruitment, and there are some other things that I know the Honorable Minister will be doing to help to retain our nurses. Yes, we talk about remuneration, but all the time that is not the first priority. There are some other things that we would want to see, and I think in time, as we seek to basically engage you, in time the Minister will let us know the things that he is planning, because we would have discussed certain things before. He is planning in terms of making sure that nurses are being retained. Every day you have nurses leaving. You have to be verifying them. They're going to places that you call they're greener. And greener sometimes for them is not just about money, but greener is because of upward mobility, greener because the environment to which they work might be feeling not so toxic. So we, from the Ministry of Health, we are doing everything in our power to make sure that where the nurses are, they are much more comfortable. In that way, they'll be able to produce at a high quality. Thank you.
Thank you, Nurse Christopher. I have a photo there on the screen, and that is a demonstration of what progress looks like. This is a clinic that operated in City East. And look at it carefully. And it was after we opened the Villa Polyclinic that we were able to close that. But you can see how some of the conditions we had our nurses in, and some of the conditions we had our patients in. So that is no longer operational, that all the clients from there are now served at the Villa Polyclinic. Look at some of the conditions. And this is what we met in 2004. It's a demonstration of the performance of this government. And I just would wish to say, 2014. Yes, thank you. I just wish to say that I was very heartened by the presentation of Dr. Bell Jarvis, and especially as she wrapped up. I want to support her view that in Antigua and Barbuda, we tend to be gravitating to a culture, a sort of pull-down culture, that even when something is accomplished, we don't even are inspired. If you cannot be inspired by good as a society, then we are going to have difficulty in being able to take advantage of the opportunities ahead of us. Now, it's been an hour and 20 minutes or 25 minutes, and so it's now time for the media. So here you are. It's your time now.
Can you hear me? Yes? Okay. Morning, Alicia George, ABS. And I think this question is for both the Minister and Ms. Christopher. Both the Browns and All Saints Clinic, they serve a massive population. I wanted you guys to speak more about the extent of the repairs that is required for either clinic, please.
Well, let me allow the nurse to speak first.
If you're aware that at the end of, just about the end of July, about the 22nd or so, we would have basically transferred the nurses from Browns Avenue Clinic at that time to Grace Farm. we would have been down there for less than a month, just about, while they were preparing the IDC center, because you cannot prepare a place where persons are. So they are now at the IDC center, which is the new temporary location for Browns Avenue Clinic, in preparation for the rebuilding of Browns Avenue Clinic in itself, where it originally is. There are some plans for that, and that is going to be a major development. And the minister would have basically mentioned some of the things that we are hoping. I remember talking to one of the persons that likely to be, they are looking at a double floor, but I know in terms of the contractor, the minister will speak more of that. So we are presently now trying to deal with our area at IDC Center. So that's where our temporary location is, at Old Halberton. Call it Old Halberton, persons who quicker know. It's a smaller area, but very conducive. The services can be given, and the services have already started. The same goes to All Saints. We are hoping All Saints are basically at this time at Granville's. Of course, some persons have not been going because they feel it's a far place and everything. So work has already started there, so that soon we can get them back to All Saints Clinic. And as you would have heard from the minister earlier too, there'll be added services that will be given when we expand that clinic. So that's the plan, but everything takes time. We just have to have, I believe everything will be done before the end of the year to early next year.
Well, one of the things we have to achieve is the expansion of the facility, because we are adding more services, and that is the challenge. I know, for instance, at All Saints, we were able to get a building that we didn't have before next to the clinic, and Dr. Marshall has indicated that that building, he will move his dentistry out of the clinic and he will develop the dental service in that building. We think we're going to need a little more land to expand, to do the service, and I did indicate the expected added services, and that is one of the issues with All Saints. It would have been easy for us to go and repair the building and just say, let us provide the same set of services. But I don't think that would be the advantage of the community, because it is such a large community. You want a polyclinic-like arrangement in All Saints. Take, for instance, EKG. One of the issues that is so simple to provide that service. But if you don't have the space, you cannot provide the service. And X-rays. Right now, we have a lot of heart disease in Antigua and Barbuda, and people ought to know their status. If you're in All Saints and you feel a pain in your chest, you shouldn't have to be calling an ambulance from St. John's if you live close to the clinic. You just go to the hospital, do a simple EKG to see your status. And that's what we would want for All Saints, as well as Browns Avenue. But the All Saints one is far more critical, because in Browns Avenue, you're about 2-3 minutes away from the hospital. But in All Saints, with the traffic we have today, and that's another thing, it's very difficult to get around in Antigua and Barbuda because of the number of vehicles. And even though you have the ambulances, sometimes the ambulances get stuck because of the high traffic volume. So All Saints is critical, and we intend, I'm going to push for us to implement the full program in All Saints, notwithstanding the sniping that is going on and trying to cast blame. We should not knee-jerk when there are other detractors open their mouths and criticize. Let us stick to our plan. That is one of the most critical clinics in the whole of Antigua and Barbuda, and I'd like to see the full plan implemented.
Just you want to ask my follow? Go ahead.
So I'm wondering, Everton Barnes here, and I'm wondering, Oh, this is coming in. Good morning, everybody. Oh, good afternoon. This is a very simple question. You're providing transportation from Alsins to Glanville. Is that still in place?
Yes.
And what about from Browns Avenue to the Halberton? Do
We-
you
we-
have those arrangements?
Well, we have looked at it, and it's something that is on train. It basically will be happening.
No, I cannot-
But we don't. Yeah. Okay. Good. Okay. Shuttle.
The people who would normally go to Browns Avenue, we are creating a shuttle from Browns Avenue up to Halberton.
And in terms of the clinic at Alsins, where are we in terms of the actual construction? Because it's been 2023, you said that it was closed for repairs. Where are we in terms of the construction?
Well, for instance, I've been advised today that the contractor has asked that the building be completely emptied. So work has essentially begun. You have to get all the equipment out, everything out. They're there now. So with the nurses to empty the building.
And do you have a timeline on completion?
It's difficult to put a timeline on it because one of the biggest problems, in all sense, I have the report here, it seemed as if the design of the sewage system was poorly done. So this is the nurses were complaining because all the pipes in the kitchen, in the bathrooms, feed into the same septic tank. And so the fumes back up. So when you're in the dining room, you're smelling that fume. Normally, it's in a pipe that goes up and goes above the thing. But the design, the ventilation or whatever you call it, the flow, the airflow, in the floor. And that is what happened. And the reason why I think they did that is because they have a concrete roof. So that problem has always been a serious problem to solve.
Okay, just before you
back
go,
my
somebody online is asking, where is Bronx Avenue relocation? So I just want persons to be aware. That's why I said Old Halberton Hospital is easier for you to know. It is there, basically where Casualty used to be. That's where Bronx Avenue, and the sign is up. So when you go, you will see the Bronx Avenue sign of the relocation. And just to add to that, there is something that the ministry is looking at, and we are still in discussion, and we will be in discussion with other stakeholders of that. For Bronx Avenue Clinic, we are looking at flexible times, but we are not doing it yet because studies have shown that sometimes persons are not able to go to the clinic between the hours of 8 to 4. As would have been the original thing. But the new studies have shown that persons do visit the clinics after hours, even for child health or whatever. So it's something that the minister is pushing, and we are looking at it, and that will come in time.
My follow-up question was in terms of cost. How much will the repairs at Browns and Alsins cost? And I was also curious to know what the dry run at the new cemetery entailed.
You know that we are not going to continue the system of digging a hole and putting that same material in a hole, and then you end up with a big mound. And we are not going to continue the practice of using backhoes to fill the graves. I think that is so terrifying on some of the families, where you hear this clanging and so forth. So we have what is called an equipter that is preloaded with finer material, that on the day of the actual burial, there'll be no backhoes. It's just this equipter with the material in it that backs up and then fills the cavity and the earth. And that dry run was to see how the operator would function. You're not going to be hearing a lot of noise. It's a quiet piece of machine. And to see how high a volume you need. How much do you need in the equipter to fill it? Now, what we found out is if you get a backhoe just to dig a hole, depending on the earth, the consistency of the earth, you could get fall in. You start digging, and it falls in. And so there is a system that is developed for preparation of preparing the grave, and that is done manually. So that when you go down about 6 inches and the backhoe starts digging, you do not have the effect on the surface falling. It is a nice square, what you call cavity that is created. And that is working out well. We were up there Sunday doing the pre-run, and we found out the answer. And so the backhoe operator has already now mastered the art of doing proper digging without having the edges twisted and so forth. It's a pre-run and it works. By the way, you're free to come and take a look on the 1st of September when you're likely to have the first burial there.
Just making sure the bodies were used in the process as well. Do we have a cost for the rehabilitation of Browns and All Saints?
The engineer is there, and I don't think that even though there has to be an issue of cost, I don't think that is prohibitive. The fact is, the amount that was estimated initially was $450,000. I think I saw that in a document. But that is irrelevant at this time because, as I said earlier, we are going to, I will be pushing for the expansion of All Saints Clinic. So it's likely to be more than 450,000.
Just a quick follow-up on that question. You said cost is prohibitive, but
It's not prohibitive.
Sorry, not prohibitive. That's correct. What about the timeline, the specific timeline that the contractor will have to get the rehabilitation? What is the timeline? Can we get a response on that?
Well, I don't like to get involved in that, but without knowing the technicalities, I would like to see All Saints up and going in 6 months or less. That is my personal wish. And I think it can be done. And we'll put the necessary resources together. There is a relatively solid structure there. And by the way, most of the time it has to do with how many hours you work, whether you work in the nights and so forth. I can make the commitment that because of the crucial and strategic importance of hospital, we're going to push, and tomorrow I'll have a better idea, for it to be done within the next 6 months.
I know that we spoke, I think a few months ago, when I forget the name of the institution came down to Antigua to do some dental care, eye care, and other sort of matters.
United Hands.
United Hands. Thank you for that reminder. And you spoke about the need to, create spaces for Antiguans to use these services or utilize more services, probably on the weekends,
Yes.
when persons are less busy. What has been the discussion from that particular point?
Well, we have that internal discussion with my permanent secretary here. The next step is to meet with our nurses and our doctors to see if we could get them to buy into the idea. But I think the nurses and the nurses in particular, are of the view it's a good idea. Because what we do normally in Antigua is to wait for people to come to the clinics. And they don't come to the clinics when they feel healthy and strong. They come to the clinics when they have an ailment, a headache, stomachache, and they feel weak and they don't feel up to par. And sometimes, even when they feel that way, they're very sick. So what we're saying is that we would create events like on weekends. We go to certain communities, but we have a cadre of doctors and nurses and technicians that go and say, look, at such and such a day we'll be in All Saints, and we're going to have this health fair. And when people will come, and that has proven to be true, that people will come in large numbers. Do you know over 4,000 people actually showed up at the multipurpose center, and I think we served about 1,500 of them. Yes. And we want to, I spoke with the acting piano, we want to really design that program and go into the communities like on a Sunday or even a Saturday. And if the churches want us to come and they're saying, okay, have a big congregation event, we will go. That's the kind of dynamism that we are putting into healthcare today. You want it? No, you go ahead, Pierce. Go ahead.
All right. And to follow on from what Minister was saying is in terms of getting the children back into fluoride care within the schools. So that is something that we are vigorously pushing to commence in September, that the fluoride program. That's what it's called. And then we're also looking, in addition to having 2 mobile vans to go to the schools, to go within to our various communities, to deal with the children as well, to deal with our elderly. Because from our national health fair, we saw that a lot of persons, they basically not looking about their teeth, right? And that is something that we are paying a lot of attention to. Thank you.
Well, at GIS, just a quick follow-up on the mental health facility in Seaview Farm. We have not heard a lot on that lately. We just need a...
All right. With regards to the work that is being done at the former, yes, at Seaview Farm. We are currently in the design stage. The plans have been done and delivered by the architect to the ministry. We're looking at that because we want to make sure that whatever is being put in place, that it's the best. And safe, well, the best, that it's safe to our patients and our workers as well. It's a 4-floor building. We are also looking at the possibility of putting an elevator in, and an additional unit to house those persons that are really, how should I say, this mentally challenged. Let's put it that way. So there are quite a lot of work that has been done with regards to that. But the ministry as well, in order to get it right, we're ensuring that we bring in a consultant in short order to look over what it is that we plan to basically to build at this point. So that is where we are at the moment. Again, it comes again with retraining our staff, ensuring that we have the adequate amount of doctors and nurses in place to run the institution. So we are looking at the entire human resource complements of the institution, and to ensure that the public understands that it's a rehabilitation facility, to move away from the stigma of basic, what we call crazy house in the days ahead, before. So that is where we are currently. Minister, did I forget anything?
If I may come in as well, Minister, collaboration and discussion with the Celeste Baird Medical Center has also been crucial, because as it stands now, Clearview primarily is able to offer inpatient services to those who are 18 years and older. So a very important part of the new institute will be offering care to pediatric patients. And so the consultation has already begun, because at this point in time, if we do have a child who has mental health concerns or needs to be, in a place of safety, then at this time they are admitted to the pediatric ward at the Celeste Bird Medical Center. You can already imagine the challenges that can be faced, where we have patients who are in for communicable diseases, so you have your gastroenteritis, your pneumonia, etc., non-communicable diseases, your epilepsy, diabetes, and you also have persons who may have behavioral concerns, maybe throwing tantrums, etc. And so it's very important for us in preparing the appropriate mental health landscape that we plan appropriately for our pediatric population, and so that is going to be a new arm to the new facility as well.
One of the things I forgot to mention, and I mean in discussion with Minister this week, I thought it's important that whatever it is that we're designing going forward for the dental aspect is to have a pediatric dental area specifically for children. Because sometimes they go into a dentist, I mean, us as adults, some of us are basically scared when you hear that machine starting up, so you can imagine with a child. And so one of the things that we're focusing on is having an area specifically for children. So a dentist who is specifically, or what we call a pediatrician dentist, a pediatric dentist to deal specifically with the children as it pertains to dentistry. So that is one of the things we're really trying to get done.
There's a tendency for the public to get a little anxious and hasty. And let me tell you, I am very, very concerned that we take our time. The old people say, take your time and walk fast. See that facility up there, the government spent $13 million to purchase that facility. It was not designed for Behavioral Health Institute. And so when you start going up on floors, you have to think of the security of the building. And the building must be self-sufficient, self-contained. And one of the things, after the architect finished and we saw the design, the whole issue of a pharmacy was overlooked. So you have to go back to PAC and you have to redesign it to have your own pharmacy with the necessary security, because the kind of pharmaceuticals that you have there could very well be of interest to people who don't need it. So all these things, you have to take your time and make sure, especially in a facility like a mental health facility, and we're saying our term is a behavioral health facility. So we are making some progress. The plan is there now, and it's for us to now take a closer look, as close as possible. And the PS indicated, we're not taking any chances. We want to bring in an expert who was designed this, who was trained to design these type of facilities. Because God forbid that you have a patient on the second floor, and then what happens if you don't have the appropriate security? I'm very concerned about that, and that's why we're saying we want to bring in the experts.
Okay. So this question is for the PS, because you mentioned the public consultation for mental health. To the extent that you're able to, can you tell me the impact that this legislation is expected to have and the feedback that you expect from persons during that public consultation?
The Mental Health Act was basically, how should I put this? Redrafted, I should say, a few times. We want to ensure that persons understand that the Mental Health Act is not basically designed for basically to lock up persons within an institution. It's basically to change the way that we were operating many years ago in terms of rehabilitating patients. We want them to be back within society, living a normal life within reason. And so, though the act was drafted, we want to ensure that the general public understands it and basically, share their views so that we can essentially take into consideration. We're not trying to push anything down anybody's throat, right? We want them to be a part of it. And of course, once their views are sound, of course, those will be taken into consideration and will be implemented into the Mental Health Act. That is why we want public health consultation, so that they are a part of it and that they are able to contribute.
Where would we be able to find the announcements when you guys are ready for the public consultation?
To the media. Okay? So you will get it.
This is my last question. To the minister, you mentioned that standards and restrictions for Tranquility Park, that will be enforced, and some of it will be legislative. Could you just clarify which part of that, of what you stated earlier, would require legislation?
We're going to have to amend the law from 6 feet to 9. And we're going to have to, for instance, in the law, we shouldn't be burying people after sunset or something like that. These are the basic laws that, yes, there's a basic laws. And by the way, I did not mention this. The 1st of September will also be the inauguration of cremation in Antigua and Barbuda. That will also be according to government policy. And even that, we do not have regulations on cremation. CBH, Mr. Spencer, is at the moment developing the regulations for cremation. It might not appear to be important, but when you have ashes and so forth, there ought to be regulation how it's handled, how it's stored, and who can carry it out. What do you do with the ashes? We don't want any funny business in Antigua and Barbuda. So we have to look at it carefully. And in terms of the behavioral aspect of it, we might have to put some of those in the current law. Why should somebody be free to come to a funeral, walk around, make noise, smoke and drink and carry on? It should be an offense. And unless you get that on the books, you might not be able to execute the kind of response that is in the interest of the public. So we have to, when these things develop, we must take our time and look within the existing laws, our culture, our values. And so that's what I was talking about.
So, Minister, I listened. You've done about 2/3 of the clinics in terms of
intervention to improve their. Yeah.
And then you had
I think I did more than 2/3. That's all.
Celeste Bird as well. Medical benefit is footing the bill for much of this, I understand.
Who?
For all the repairs.
For Celeste Bird?
For Lester Bird and the clinics.
Medical
the funding for all these projects are coming from medical benefit.
It's coming from the Treasury as well.
Or from the Treasury as well.
As well.
Because about a year or so ago, the government had introduced, what they did, they approved an increase in terms of what people pay for the Social Security to add, because to make up for the shortages. And I was wondering with the demands and the expanded demands that are being brought to bear on medical benefit scheme, if there's any thought given to perhaps raising the contribution to medical benefit scheme.
Look where you want to take.
No. I'm just asking. Sir. It's a question, sir.
No, well,
it's a question, sir.
Right.
If you give me any thought to that, and I ask that question also in light of the plans that you have announced in terms of having a national health, in the context of having a national health
insurance.
Health insurance.
Yes. Well, what we have done, and it's an important question. It's an important question because when we started out in analyzing and collecting data in Antigua and Barbuda, and we had the University of the West Indies Health Economic Unit. I remember speaking to the professor, and he was not concerned, but he wanted to know our plan as to whether or not we would be willing to increase the what do you call it? The deductions, contributions. Yeah. So I said, my thinking is that medical benefits should try to pay for the total health care in the country that come before them. For instance, one of the things we're doing now, any disease that we cannot fix in Antigua, we pay to offer patients to go abroad. Dr. Bell Jarvis knows this very well because we have been spending a lot of money sending people abroad for heart disease and other things. The idea is that if you expose medical benefit to the full demand of what it costs to provide health care, whether it's here or overseas, and they are able to meet that demand on the basis of the deductions now, that is a good sign that we might not require or have any need to go up on the deductions. So far, we are able to meet all those financial demands without getting any deficit or any shortfall. So it looks good. But there is also another dividend. If we get the doctors here and they're affordable, it might be less costly than having to put people on a plane and they go over there and have to bring them back. So the question is important to highlight that we are indeed looking at it because we'd prefer not to increase the deductions. But if at the end of the day it shows it's in the best interest of the public, where they can get neurosurgery services here in Antigua and Barbuda, cardiology services in Antigua and Barbuda, and all the things that Dr. mentioned this morning, Dr. Bell Jarvis mentioned this morning, we want them here. We do not want Antiguans to be in a situation where they cannot afford the services they require to stay healthy and to save their lives. We don't want that. We have to set a high mark on the lives of the people of Antigua and Barbuda. That is the challenge to us. You ask yourself, if you should get sick and you need a neurosurgeon, how would you feel the government says to you, it's too expensive, we cannot afford it. What's your option? These are the things we face. And this is why I push the policy, and the government has accepted it, that every citizen in this country who needs money to go abroad to get care, the government must find the money. And when we look at what it will cost, because we're going through a very critical period, we have not turned down anybody. So at the end of this year, this is a good year for us to look at the data. I think you agree with me. We've had so many folks that we have to send abroad. And we say at the end of this year, we look at the financial performance of medical benefits. Look at all the costs so far. In 2025, I think we're going to have our highest costs. And we say, look at the finances. And the finances show that we're able to do this and end up with a surplus. It's going to be a wonderful thing.
And Minister, can you give us an update on the plans to establish the National Health Insurance Scheme?
Yes, the University of the West Indies team is back. And they were at Cabinet, about 6 weeks ago, to make a report and to update Cabinet. And now what we're doing, we're bringing them on board with our team in Antigua, and according to our projection, hopefully, and I hate to do this, but I have to be careful when I say this. But let me say, early next year, that we'll have a proposal before the government to select options of how best to go about it. Yes.
I know I said it was my last question.
No, that's all right.
But we spoke a lot about Antigua. Nothing was said about Barbuda. With the growing population over there,
That's not true.
there's
That's
no
not
growing
true. Let me
population?
correct you. This morning, when I...
Oh,
went
I
to
meant nothing was said here, not in general, but
Oh,
here.
okay.
Are there any challenges with the growing population, or what improvements are being looked at on Barbuda when it comes to health?
Yeah, you want to answer that? Yeah.
Sure, I can speak to this. We have been striving to see how we can optimize the operations at the Hannah Thomas Hospital. One of the particular areas of focus is basically maternal and child health. So at this point in time, in terms of deliveries, especially for mothers who are primigravidas or first pregnancy, they have to deliver here. And the reason is that we have to really look at the safety in terms of delivery, but also being able to convert to surgical intervention should vaginal delivery become a challenge because of complications, whether it be on the face of the mother or of the baby. This is something that the Barbuda Council and persons within Barbuda are very passionate about because they want to deliver in Barbuda. You can think about them having to come over to Antigua, having to find accommodation. If the baby does require admission to the neonatal intensive care unit, sometimes it can take a significant toll. So in collaboration with various committees, the Maternal, Child and Adolescent Health Committee, we have been looking at how we can revitalize the midwifery services in Barbuda. We actually do a visiting pediatric clinic as well, so that babies who would have required follow-up here for whatever reason, we're able to see them on a regular basis to offer that specialized care there. We've also, you've noticed, through medical benefits scheme, have been focusing on preventative efforts, especially as it relates to nutrition and through persons knowing their numbers. As a matter of fact, members from medical benefits were just in Barbuda over the past week or so. I was actually in Barbuda about 2 weeks ago running a pediatric clinic. We also have other visiting specialists to include the urologists, obstetricians. We've also done ophthalmology and dental services. But what we ultimately want to see is a consistent availability of these specialized services so that the trips over to Antigua can be reduced, and we want to optimize the services that are available at the Hannah Thomas Hospital. Yep, so we have really reviewed it. There's still some way to go in terms of optimizing skill set and ensuring that the appropriate equipment is available. One of the things that we have ensured is that when we go, we also do staff training. We do staff training based on gaps that we have identified, as well as staff training based on areas of interest that they have also expressed. One of the things that we have had to ensure is also that medical evacuation from Hannah Thomas Hospital to Celeste Medical Center is seamless, so that persons can be transitioned to Celeste Bird in a timely manner. We previously had challenges with medical evacuation in the evening going into the night, but that has basically improved. And the other thing I must say in terms of pediatrics, the pediatric ward, actually through collaboration with other stakeholders, is almost ready. The walls are painted, equipment is in, so basically now we have to look at policies/guidelines that would govern the operation of the pediatric ward. But I'm happy with the progress thus far, but I think we can strive to step up the pace in ensuring that the level of care that is available post-Irma is back up to where it was before, and even far surpassing where it was. Yes, as well. So one of the things that we have ensured as well, especially as we collaborate with the Trinidad Eye Hospital, is that every time they come, we must have persons from Barbuda part of the list. must. It cannot be a case where they do not get to benefit from services offered at the Celeste Bird Medical Center. So we strive to ensure that whatever specialized service, even when we have a visiting pediatric surgeon, visiting neurosurgeon, we try to ensure that we keep a log of the cases that need to be seen by these specialists so that they can be informed in a timely manner and come over as well.
So, I know, Dr. Beljar, you spoke during your earlier opening remarks about the anesthesia specialists or the person getting training from anesthesia specialists. You have two additional pathologists, a neurology specialists, and other persons coming on board. My first question in that regard is, how vital is this to, helping to expand the service of the Celeste Bird Medical Center, as you said, that we don't have to send persons overseas, as well as are there any other gaps that you're seeing that you hope training can help fill in?
One of the things we strived to ensure at the beginning of this year was that we would have reviewed our staffing and basically we would have created what is called a critical hires list. This speaks to specialists who we deemed urgent, emergent to be here to ensure that we can offer services without having to medically evacuate persons. At this point in time, the hospital only has one neurologist. You can therefore imagine if you have a patient who, you have two patients in the ER with a cerebrovascular accident or stroke, or someone else who is having uncontrolled seizures. You can see the challenge that we would face in terms of timely intervention. And also it is almost impractical to have one doctor on every night, even when he is on vacation. And I can call his name, Dr. Osman makes himself readily available to discuss any case as it relates to neurology. The other thing as well, the wait times. The wait time at this point in time to see Dr. Osman in the clinic is 3 to 4 months. This for us we deemed to be unacceptable. And so we would have just concluded interviews last week in hiring an additional neurologist. Let's look at pathology. When we think about cancer, the importance of making a timely diagnosis and intervention. When we think of our cervical cancer elimination program, we recognize the importance of having timely assessments done. And therefore, we deemed it important to optimize our pathology department. Again, last week we did interviews for 2 additional pathologists, so they're not here yet. We're hoping that one can be here within 2 months and the other within 5 months to strive to optimize the human resource capability in terms of pathology. We don't want to have to be sending the samples privately or overseas. Everyone should be able to access that service within the hospital system without having to spend additional funding. As a matter of fact, we even have a relationship with a university in Miami where when specialized testing is required, there is a flat fee that is charged compared to additional fees that can actually rack pretty high up if it's done privately. In terms of pediatric emergency, at this point in time we have a pediatric casualty that primarily runs from 8 to 12. If you pass through the emergency room, it is very disheartening to see the most vulnerable of our population waiting to be seen. And therefore we found it crucial to have a pediatric emergency specialist. As a matter of fact, the vision in the long run is to have a pediatric center where we're able to have a facility dedicated to pediatric emergencies so that our children no longer have to wait along with our adults. The other asset of having a pediatric emergency physician is also training. So the plan ultimately is to have our general emergency room physicians working along with the pediatric emergency consultant to enable capacity building. Ophthalmology, we continue to build because at the end of the day, we want to build capacity. So we work along with THES, but we must build local capacity. At this point in time, we have one of our local doctors who is away studying cardiology. She is due back by the end of this year. We have one of our local physicians away studying gastroenterology. And we're happy that we've gotten the scopes so that we can do upper GI endoscopy, so take a camera and look down, or do colonoscopy as well. But we we must ensure that we have appropriately trained persons. So what we're doing, we're looking at the critical areas. We're trying to see how we can train our local physicians, but in the interim, we overlap that with bringing in physicians so that we can have continuous services available instead of having to medically evacuate all the time. Neurosurgery is an area that we have to fill, because I'm telling you, just to do, depending on the intervention, you can spend $30,000 for one neurosurgical intervention. If you have to medically evacuate by air ambulance, the minimum is $20,000 to $30,000. So you can imagine that it is cheaper to actually bring the surgeon here or have the surgeon a part of your staff so that you can cut out that cost of medical evacuation, hospital stay, additional medication, and so on. The other service that we would have optimized as well is our gynecological oncology service through Dr. Quinlan, who is now a part of our contracted staff, and that is very pivotal in our move as a country to eliminate cervical cancer. So we've had the critical hires that we've identified, and we move forward in trying to fill these gaps. We got a cardiologist as well, did I say? We have a cardiologist who is currently on staff, and as I said, one of our local physicians is to come by the end of the year.
Mm-hmm. My penultimate question is regards to the mental health discussion. I know that we've spoken at breadth about the facility, we spoke about the consultations, but I was just wondering, has there been any assessment of how effective the hotline that we have is operating? I know I'm not saying that it's going bad or there's any issues, but I just wanted to find out if there's been any review of that mental health hotline to ensure that workers or persons who are staffing that hotline are, kept up to training in terms of how to customer service, it's always well staffed.
I said earlier, from time to time, you will get the different specialists to come and speak to the press. But I could get you some information and pass it on to you. Yeah.
And my final question. And this is something I experienced a few months ago, 2 months ago, and so it was sort of question bred in my back of mind. Related to one of our staff works at Observer, I did deal with EMS, and when you spoke about stroke center, I was kind of thinking of this question. We had a situation where our worker or our co-worker was not operating as he should, correct? And so we clearly understood that he was not, in his correct sort of physical health and everything. So we called EMS. I just wanted to find, however, we got sort of, I would say, I wouldn't say negative, but sort of that sort of questioning sort of personality from the EMS, why we called EMS, to help look after our co-worker. Because clearly our co-worker said, no, everything is fine here, I'm good. But clearly for us as co-workers, we could see him wrong. So the question is, has the ministry looked into continuous training of our EMS, as particularly relates to stroke and those sort of instances, or those sort of health emergencies where it might not be as clear, or certain instances where it's not clear to the person in question that he's going through some sort of a medical emergency, despite the fact that other persons can clearly see it?
Yeah, but it's an interesting question. I don't know if I understood carefully, accurately. Are you saying that someone was not feeling well, or you observed the person not looking as if the person is unwell? We
understood that he was not unwell.
You made that assessment that
yes.
he's not well?
Yes, I think multiple persons made the assessment he is unwell.
And he felt he was well?
And he felt he was well.
And you wanted the EMS on an emergency basis to mobilize to come and get him?
No, whether or not the EMS on that emergency basis were well trained or have the training capacity to understand that the person in question may not always have the best sort of frame of mind to understand that they're having a medical emergency where everybody else could see it.
I don't know. You can have me that.
I do appreciate your question because sometimes you may go, a person may say, I'm fine, I don't need to go to the doctor, whereas you can see that there might have been a change in speech, there might have been a change in how the face may appear, you might have noticed that they may be a bit confused. I can speak specifically to stroke care. In June, we would have had, as a matter of fact, May, June, we would have had a 6-week virtual health summit as a part of our stroke certification, and that was followed by hands-on training. And one of the things that the persons from the World Stroke Organization would have looked at would have been the timesheets as it related to EMS, from the time that they were called to the time that the patient was picked up to the time of arrival. So they looked at us running a stroke code, and it so happened that while they were here, an actual patient came through. So that's not something that you can basically make up. And they were able to go through and say, okay, why did you suspect that this patient had a stroke? What was your time from call to arrival, arrival to hospital? What did you do in the interim, etc.? So from the stroke perspective, as a part of our training for certification, they reviewed how the EMS operated as it relates to stroke response. But I do appreciate the question because there are many times, even for mental health concerns, that patients may not think that they need to go to the hospital, but the EMS should be able to say yes and pick up that I'm going to take you, but we have to also look at consent. A consenting individual, is there a threat to life? But I will only speak, as Minister said, persons from varying specialties, to include EMS, will be here to give a better account as to various questions that you may have. But from a stroke response, the EMS was included in the training, both virtual and hands-on, and they were formally assessed in their response by the World Stroke Organization.
Yeah, but the question you asked is you wanted to know whether or not the EMS was properly trained. I can assure you our EMS is properly trained. I have a question for you, though. Let's assume that the EMS showed up and the patient said, listen, I am fine. I don't want to go to the hospital. What would you have done then?
Well, are you talking from me as a person?
But you were with a group. Is your coworker,
right?
And many of them were there, as you said. Many of them felt that he was really ill. Now EMS shows up, and the gentleman or lady says, "Look, I don't want to go to the emergency. I am fine." What would you and your colleagues do?
I think from our perspective, the next stage will be to find a different consultant who can give us more information based on what we see and what we hear from him, what we observed from him during that particular period.
But you see, because you would not have been in a position, apparently, to persuade your colleague to go to the emergency because he's resisting.
Yes, because we're not a medical professional, so we can't correctly tell him this is what you are experiencing.
Okay.
At all points, the EMS, I would say, they're appropriately trained. They are able to pick up triggers, they are able to pick up red flags, and they are able to appropriately respond. And I think at the point in time where they are able to be given the platform to also respond, that we can further explore some of the concerns that might have arisen in the past. But I can say, working within the healthcare system, I have seen a significant improvement in terms of the response of EMS, the fact that they have advanced EMTs, placing IV accesses, starting IV fluids, looking at the response time. There has been a significant improvement in the service and will allow them to speak once given the appropriate platform.
Do you have any suggestions?
None.
I want to thank the media for your willing participation in this. And I think that there's great value for the ministry to have this kind of exchange more often. And what we will do, we'll bring, we have a big staff, and we'll bring others like the chief medical officer and others who will come and address the media from time to time. So you can be assured that this is not a one-off situation. And we intend to keep the facts of what we are doing before the public. So whenever there are speculations and so forth, then we can get the true situation to the general public. I want to say that what you have seen here on display, my permanent secretary, the medical director, and my acting principal nursing officer, you can see from their responses that they're well on top the situation in terms of public health in Antigua and Barbuda. And I'm confident that if we can get the support of the media to help get information out and to help the people of Antigua and Barbuda to balance based on information from all over, to balance their perspective, I think would be a greater country. And I refer back to what you said this morning. We have to be more positive and appreciative, especially when it comes to the Celeste Bird Medical Center. I will share with you, the emergency sees almost 40,000 people every year at EMS, at the Celeste Bird Medical Center. The minimum you're likely to see in any year is 36,000 people. How much is that per month? That's $3,000 per month. 3,000 people per month. They're hard-working people. And I think that I publicly appreciate the effort they make, and I want to encourage them to continue the excellent public service. So thank you, and thanks to the media.